Hello and welcome to Health Beyond Borders, where we explore the stories of people and purpose behind Malaysia's thriving healthcare industry. Okay, so with me hari ni, this is our second or third episode macam tu, or fourth episode. I think today is the fourth episode. So we have been discussing about our Malaysia's healthcare industry with the people from our members of hospital. So hari ni we have our two guest from Damansara Specialist Hospital 2. I would like to welcome together with me hari ni, we have Dr. Noor Liyana Khairuddin, CEO of Damansara Specialist Hospital 2. Dr. Noor Liyana. Also, we have the handsome Dr. Zhen-Vin, the consultant of International Cardiologist at Damansara Specialist Hospital 2. Welcome, Dr. Lee.
Well, thank
I
you very
can call
much,
you
Ellen.
Dr. Lee kan? Dr.
For sure,
Lee and
yep.
also Dr. Liyana.
Yes, of course.
Okay, how old are you, Dr. Liyana? Lah soalan.
Wow. Am I supposed to say that online?
Oh, okay, privacy matters. Understand.
You
It's
guess, and I'll tell you if you're close or not.
because she looks so young to be the CEO. So if she is 35 years old, I'll feel so downgraded. I'm 35 also, but no longer CEO. Not yet. Anyway, Dr. Lee, how are you?
I'm doing great. Yourself?
I'm fine.
Well, thank you for the compliments anyway. That's
Are you
very
single?
kind of you. At this moment in time, no.
No, okay. Dr. Liana, you married?
No, as well. I am married.
You are married.
Yes.
Okay, do you have kids?
One kid.
One kid. Wow.
Wow.
How old is he?
He's 9.
He's 9 years
Yeah,
old.
he's 9.
Okay, cool. Okay.
So I'm definitely not 35.
Definitely. It's okay. Doesn't matter. As long as you look young.
Yeah,
As long
thank
as
you so
look
much.
young. Dr. Lee, would you mind to tell us a little bit about your age or something?
I'm in my 40s already.
You're in your 40s?
Yeah.
Okay, first thing first, kalau kita jumpa doctors, they are not that young, but they look young.
It's a millennial thing.
It's a millennial
Yes,
thing.
it's a
Oh yeah,
millennial
I am a
thing.
millennial
Exactly.
too. Dr. Lee, you're a millennial?
I am not a millennial
You
by
are not a
definition. Yeah,
Oh, okay.
unfortunately.
Maybe because of the profession. As a
Maybe.
doctor, you take care of your health, your mental health, you know, your food consumptions. Am I right?
Yeah, I can share some tips with you later.
Okay, you can share something. That will be in the second segment. Anyway, whether it's the doctor, okay, I'm reading the script by the way because I have to read
Yeah.
the script.
Yeah.
Whether it's the doctor on call, the nurses who keeps everything running, or the admin team managing patient flow, every role tells a story of care, discipline, and teamwork. So, by reading the script, the script has been given to me, so I have to read this one as well. We are going to talk about Inside the White Coat, a day in the life of both of you at Damansara Specialist Hospital. It's basically the life of a doctor. We need to know the life of a doctor. Previously, on our few episodes on our podcast, we have been talking a lot about very serious topics, you know, about fertility and stuff. So this time around, we are going to take a little bit laid back. We're going to talk about your life as a doctor. What do you do every single day? The first thing you do in the morning, the last thing you do in the day, like you have kids. So we need to know that. So you feel lucky because you can share your tips and tricks to be, you know, healthy and wonderfully, fabulously beautiful every single day. Okay, now I just want to cut it short because I have the tendency to talk a lot. Okay. Professional, ya, tolak microphone. Okay, so first things first, a day in the life of a doctor. Saya nak tanya, perhaps Dr. Liana first lah, because you have one kid, 9 years old.
I do.
Okay, and also you are also a working mom.
Yeah.
So what motivates you every single day when you got up on bed? So what makes you motivated to strive throughout your day?
Well, my son actually. So
Oh, so
yeah,
sweet.
yeah. So of course, family, but especially my son, because you know we want our children to grow up, right? To be the best as they can possibly be. So we need to be the role models for our children, right? So if we give up, then they'll see that. Or if we look sad, depressed, or a bit tired, or I mean, we are tired some days, right? But we try not to show it that much because we want them to look up to us and try to be the best that they can also be, right? So that's what we do on a daily basis.
So your son motivates you every single day?
Every
and-
day,
yeah.
every day. He's also my biggest critic.
Oh really? Ah,
Yeah,
9 years old.
of course. He'll
Oh,
go
wow,
like,
9 years old
"Mommy,
dah-
what
dah
are you
critic, eh?"
wearing? Or like, "Mommy, why is your hair like that?"
Oh really?
Yeah, he's such a such a chatty.
He's such a chatty.
Yeah. Biggest critic, my son.
But it's okay lah because you have something to look forward to every
Yeah,
single day. I
yeah,
think
yeah.
because nowadays we need to always remember ourselves that kalau kita bangun hari-hari, we need to always believe that kita ada goal in our life, kan?
Yeah.
If you don't have a goal in our life, then what's the purpose?
Yeah.
Correct or not? So, Dr. Lee, how about you? What motivates you every single day?
You know, honestly, my patients motivate me.
Your patience
Yeah,
motivates you.
yeah. I think that's the very reason why we exist as doctors personally. So, by way of introduction, I'm actually a consultant interventional cardiologist. So that would mean that I deal with practically every facet of heart conditions, primarily specializing in the field of unclogging clogged arteries.
Clogged arteries.
That's correct. So
Oh,
I
okay.
open them up by means of placement of stents and using balloons, etc. So that's the work that I do. So why I actually brought up the fact that I'm motivated by patients is that when you see your patient getting well, and sometimes this overall getting well process can actually be rather quick in nature in our line of work. It really motivates me. I think it drives me towards wanting to treat more patients and wanting to help even more patients to regain their previous life again, to give them a new lease of life, so to speak. Yeah, so that's
So inspirational.
what motivates me.
I rasa motivated. But Dr. Lee, okay,
Yep.
before that, I nak tanya, you are a consultant interventional
That's correct.
cardiologist. So before I go to another questions,
Yep.
can I know what is actually a consultant interventional cardiologist do? Like the description about your job.
Yeah, so a cardiologist is a specialist
Okay.
that deals primarily with heart-related issues.
Faham.
So as you know, the heart is made up of multiple different structures, and some patients can have blockages of the arteries. They can have weakening of the heart muscles, etc. So the word interventional here means that I perform interventions. Interventions here meaning I intervene on something, on a problem, and primarily this involves performing procedures as opposed to
Okay.
just consultation based by means of prescription of medications, etc. So the difference here is that I do procedures on patients to treat their medical conditions. In this case, primarily it involves, as I was mentioning earlier, opening up clogged arteries or blocked arteries by means of using balloons, stents, etc. And of course, also utilizing the latest sort of recommendations by professional societies, etc., to treat patients to restore their state of health to the best that I could.
Okay, so kiranya before a
Yep.
patient, when let's say I'm a patient.
Yep.
Okay, dah tiba-tiba serious pula kan, but it's
Yeah,
okay.
yeah.
Let's say I'm a patient because I'm quite interested with your can I say job description,
Yep, yep,
because
yep.
let's say I'm a patient, so I know that I have a clot punya arteries,
Sumbat lah artery dia.
artery
Yeah.
sumbat dan
Yeah,
macam
yeah.
tu kan. So you will be the first person that I'll see. Is it?
Ya, selalunya. Because the context with which we exist ni of course bergantung kepada simptom apa lah ataupun
I
gejala
see.
apa yang pesakit kita ada. Jadi selalunya adalah tanda-tanda yang mereka sering alami, contohnya sakit dada,
Sakit dada
ya,
on the
sesak
left
nafas
side.
on the left side dan sebagainya.
Okay.
And kalau mereka disyaki ada masalah jantung, then the first person that they usually see is of course a cardiologist.
And that is you.
That is correct. That is correct. But whether or not these patients ultimately end up having a procedure will depend on some of the preliminary investigations. Ya,
Yelah,
tak adalah kita
depends
terus
lah.
buat procedure and all that. Yeah. So when they come in, then we would see them and we
You will
would
evaluate
we
and
will
also
evaluate. Yeah, we'll
give
perform.
suggestions like this is what you should do, this is what you should
That
not
is
do.
correct. That is correct. So some
Faham.
patients end up needing procedures. Some patients end up not needing procedures.
And that depends on your advice.
My advice as well as some of the investigations that we do. with them.
Investigations,
Betul,
the
betul.
report kan, the medical
Report
report.
test, etc.
Okay.
Yep.
You terus pergi masuk balloon now. Terus. Okay. Now, talking about that, it seems like you are very passionate in your job because I can sense that. So do you always know that you will always be a doctor?
That's a great question. Well, yes.
Ooh.
Yes.
Daripada bila? Since you were young? Since you were child?
Yeah. Because I've always enjoyed the thought process of being one. I've always enjoyed the ability to heal because I think that's something that is noble. Everybody would fall sick at some point in time in their lives, and having the ability to treat and to heal and to make people happy again, make people healthy again. That is something that have stuck with me for a long time.
So kalau macam kecil-kecil dulu kan,
Yeah.
cikgu sekolah ada tanya, you nak jadi apa bila besar? Dr.
Doktor
Lee dah
lah.
tulis dah tu nak jadi doktor.
Pilihan pertama doktor,
Pilihan
kedua
pertama
doktor,
doktor.
ketiga doktor juga.
Oh,
Macam tu lah.
faham.
Wow.
Very ambitious nak
Yes,
jadi
yes,
doktor daripada
very,
kecil.
very sure
But then
of
Dr.
it.
Liana, you
Yeah.
are a CEO of
Yep.
Damansara Specialist
Correct.
Hospital too.
Yeah.
So you have the medical background previously.
yes.
So you macam I need to know we talk about backwards balik lah
Yeah.
kan. So your career journey tu, you started with apa dulu and then
Okay.
suddenly now you are becoming a very successful CEO at a very young age. So inspire me.
So I also am from medical background, so I'm a doctor. So unlike Dr. Lee, who nak jadi doctor. So when I was younger, I had multiple ambitions. Nak jadi newscaster lah, nak jadi dancer lah.
sama.
Yeah. So like
Jadi-
all
nak jadi
this,
artis.
like yeah. But you know, tak jadi lah, right?
Tapi tak jadi artis lah.
tak jadi.
Tak jadi.
So but then I eventually went into medicine.
Okay, cool.
So one of my pushing factors for me to do medicine was actually my sister. So she became a doctor first.
Okay.
So one, a role model. Two, I'm very competitive lah, right? Tak nak kalah.
Your sister gap apa the age gap between your
3
sister
years.
and you is 3 years.
3 years, yeah. So she's
okay.
an
So very
ENT surgeon.
competitive lah between you and your sister.
Always from kecil
You jadi
sampai
doktor, I
besar.
pun nak jadi doktor.
Yeah, that was like the
Dia dah
thing,
jadi
right?
CEO ke sekarang?
Tak, dia ENT surgeon.
Oh, di ENT.
Yeah,
So you
yeah,
win.
No. she's a very good ENT surgeon. So, but you know, I was in medicine for quite a number of years, about maybe 8, almost 10 years.
Okay.
So, so I came out of government, went into doing occupational health.
Oh.
Yeah, so I joined KPJ, did occupational health. Once I was in private hospital, I realized that hospital administration was very interesting.
Hospital administration,
Yes. So in the government
Uh-huh.
hospital, so usually we do housemanship for about 2 years, then we do our medical officer, then you will eventually specialize. So it's all government, it's all medical, it's very straightforward.
Structured.
Yes.
Okay.
So we're not exposed to anything in terms of how you operate the hospital as doctors in government hospitals. Yeah. So when I went into private, then I was involved in a lot of hospital administrative areas. So I was in health screening. So then I realized that actually there's so much more behind running hospital than just the medical part of it. So I took my MBA.
Oh, you took your MBA.
Yeah. So eventually I took my MBA in healthcare. Then I went into operations, and
And
a few years down the road, here I am.
the rest is history.
The rest is history.
And that reminds me kalau macam, okay, it's very interesting sebab kalau macam in, like me myself,
Yeah.
I'm in comms punya area. So we have healthcare comms, we have macam media comms. You know, there are branches of one big umbrella and then there are small branches. You nak buat healthcare comms ke, you nak buat media comms ke, you nak buat fashion in comms ke. There's a lot of branches. So good to know that the healthcare, apa tadi? Healthcare.
Yeah. You can venture out into a lot
You
of
can
things.
venture out
Yeah,
into
you
a lot
can do
of things.
quality, you can do administrative things like that. So especially nowadays, a lot of doctors are actually going into administrative. So you do your MBA in healthcare, so you can do
MBA in
operations
healthcare,
and things like that. So yes, like I think nowadays we see more and more CEO of hospitals with medical background. So
So-
it's really nice to see that, you know, more
Correct.
doctors are actually going towards that direction.
So you were in medical school.
Yes.
And Dr. Lee also, you were in a medical school.
Yeah, so both me
Both of
and Dr.
you.
Liana, so we
Alright.
graduated, yeah.
And that relates me. The reason why I'm bringing it up because another thing that I would like to know is, were there in a moment when you were in a medical school yang you rasa macam, oh, no, this is not what I'm
That's not right and you want to
expected.
leave and stuff, right?
No, I was thinking about a different thing. This is a nightmare. Ada tak that kind of moment yang you rasa macam, oh, okay, I need to step back? Medical is not. Obviously it's not, but then were there a moment yang you rasa macam tu?
Never.
Inspired lah dengan
Yeah,
Dr. Lee ni
never,
kan.
never.
You
Because,
boleh
you know,
buat ni lah, motivational talk
yeah,
lah.
in fact, you know, every day felt like an enjoyment. Yeah, every day felt like an enjoyment.
Even though when you were in the school, in the medical school.
Yeah, because of course the process of learning happens every day. Invariably there would be some subjects which you're more interested in, because we then choose our path. As you correctly pointed out, even in your field, there are all these
Yes.
different, well, subfields, as you call it. So even in our line of work, there are multiple subspecialties that we can pursue. But all in all, medicine has always been fun for me. Dr.
Yeah,
Leah?
actually, I agree.
Yeah.
I mean, even in medical school, I never once thought that I want to stop. Yeah, it was amazing.
Wow,
So I studied in
amazing.
India.
Oh, apa dia?
I studied in India,
Is it
Manipal.
Bangalore?
Manipal.
Manipal.
Yeah, so we used to have anatomy classes. I'm not sure, Dr. Lee, where did you graduate from?
Locally. Yeah,
Locally.
local
So
university. Yeah. So we
so
had
we
anatomy.
we have anatomy, right? So there's these big cadavers, and
Okay.
then you're just staring, like looking at what you're trying to figure out. Is it a nerve? Is it a vessel? Right? But it was always interesting.
Oh,
There
okay.
was never one time that you would think that this is not for me. So medical school was really fun.
I was interested dengan yang you punya apa tadi yang you cakap tu, that you were staring on
Oh,
the
so it's a cadaver.
cadaver.
Cadaver
Okay.
is
Cadaver. Okay.
like yeah lah, macam so-called dead body kind of thing, but
So you just look at it.
so you have to identify bone structures, nerves.
Observe
Yeah,
and
so that's
okay.
how we learn in terms of the anatomy of the human body.
Oh,
So not just from books,
so
but
it's
real
okay,
life.
yalah, practicality
Yes,
lah. You
yes,
have to
yes.
look in
A
front of
lot
you
of
and
practical
identify
work.
all the bones. Bones kan macam bone structure kan ada yang small bone structure, so you really have to
so
know.
many things. So of course, like kadang-kadang first classes tu ada orang pingsan lah, apa
Ya
lah.
ke?
Yeah, of course, because it's the smell. It's a first time thing. So some people didn't know, they were afraid of blood. So yeah, medical
me.
school, right? But yeah, it was always fun. You learn something new every day.
Okay, so very inspiring.
Yeah.
So I nak tanya jugalah. So fast forward, that was when both of you were in a medical school.
Yeah.
Fast forward now that you both are very successful in your career. This is an open question tau, so both of you can actually tell us a little bit story about it. So like, were there a moment yang a patient punya story, an experience yang you will never ever forget? Don't drop names, but you can just share the stories with us. Something to inspire us ke, like a patient punya story yang mungkin related to heart condition ke.
Yeah.
We can start with Dr. Lee first.
So you see, the interesting thing, Adan, is the fact that all of these things are not memories, but they do exist in present time.
Okay.
So which is why this happens almost constantly, and this is what keeps me going. So in our line of work, especially in my line of work, we do interventional procedures. The most ill of patients would come to us. By ill, I mean it really is a split-second decision as to whether they live or not, right? So some of these patients, majority of these patients will come in with major heart attacks.
Major heart attacks.
That is correct. And you can imagine the amount of stress that they go through, both to themselves as well as their family, the caregivers. It's something that occurs very suddenly. Sudden pain, a rush to the hospital, everybody's in anguish. And then we bring them to what is known as a catheterization laboratory. That's known as a cath lab. That's where the procedures are being done. So more often than not, there would actually be a blood clot in the arteries. That means that there's no flow to the artery, to the heart muscles. And in an instant, and oftentimes within minutes, the procedure is done to actually remove the blood clot.
Okay.
So then, you would see that these patients have immediate symptom relief. Like the pain would be reduced or gone. And at the same time, if they were very ill to begin with, very low blood pressure, very unstable, and then they become stable right in front of your own eyes. So this gives me a huge sense of satisfaction. And this is something that is memorable enough, and it's still occurring frequently because we treat these sort of patients. So these are the most the most ill patients that we see, but within that split second, we're then able to then restore and save a life, so to speak. Yeah. So
and it happens every day kan, Doc?
every now and then.
Every now
Of
and
course,
then
it will
lah.
depend on the type of presentation, whether they require that sort of emergency procedures to be done or not. But I guess those things would serve as good memories because you see that they recover right in front of your eyes. You have just saved a life. So I think this is this is something that I feel is memorable amongst the many other memories that I have.
because
Yeah.
it's the matter of life and death,
It is really.
kan?
It is. Yes.
And then you have
Yes.
to also, being as a doctor, you're not just a doctor. I believe you're not just a doctor,
Yep.
because at the same time you also kena, yelah, patient kan
Yeah.
sakit, and
Yeah.
then you have to also make sure that they are
Yeah,
okay.
Yeah.
yeah. So I think the emotional side of things is something that we have to juggle too. Family, etc. Yeah, patient concerns,
Betul.
worry. Yeah.
I will go to Dr. Liana, so Dr. Liana can prepare your set of answers. However, on Dr. Liana, nanti I akan go a bit deeper on your management, because you're the CEO kan, so we can go dive deeper into that. So
Right.
we will take a break for a few seconds, then we will be right back to dig deeper onto Dr. Liana's punya management skill, because she's the CEO. We'll be right back.
It begins with a small concern, a symptom you can't ignore. At KPJ, getting started is simple. Our website guides you clearly every step of the way. Prefer something quicker? Our mobile app brings care even closer. Fast access, personalized support. With just a few taps, you can book your appointment, your hospital, your time, your way, seamless and secure. From the moment you arrive, we are ready to assist, with a warm welcome and care that meets you where you are. Check-in is contactless, just a simple scan of your palm. In the consultation room, you meet a doctor who truly listens. A care plan begins to take shape, built just for you. After a diagnostic scan, your results are delivered straight to your phone, clear, timely, reassuring. Your care plan evolves with precision, guided by data, expertise, and the latest in medical technology. If surgery is needed, you're in expert hands. KPJ's skilled teams ensure safety, precision, and compassion every step of the way. Recovery begins in a space designed around healing. Our smart rooms respond to your needs, where comfort is just a word away. With robotic physiotherapy, you regain strength, step by step, always supported by a dedicated team. And when it's time to return home, your care continues. A smart device helps monitor your recovery, keeping your care team connected wherever you are. From first concern to full recovery, every moment is built around you. KPJ Healthcare, care for life.
We are back with Health Beyond Borders. With me, we have Dr. Liana and we have Dr. Lee. So we were talking just now about your memorable experience with your patients. And also Dr. Liana, since she's the CEO of Damansara Specialist Hospital too, saya nak tanya Dr. Liana lah, what is your most memorable experience with you, for you personally, when you were managing your team? Especially because dekat hospitals kan, there will be a lot of challenges, definitely. So the most memorable experience yang you tak boleh lupa. I'm sure you have a lot, but pick one.
Pick one.
Pick
In
one.
terms of management,
In
right?
terms of management.
Right. So yeah, there's quite a number, right? So of course, one of the ones that gives me a lot of memories was when probably I was in my previous hospital. So we had like an issue with a patient, whereby there was a little bit of a problem in terms of treatment and things like that. Not treatment wise, but a little bit of complaints, a little bit of dissatisfaction. But like
Oh, they complain ke on the service ke macam mana?
yeah. So I mean, complaints happen every now and then. It could be small, it could be
Orang
big.
kita masih suka complain.
Yeah, I
Tak
mean,
apa.
kalau dia rambut ke, kalau dia ni ke, I mean, there's always something, right? But the thing that's the best, right, is like actually communication with our patients.
Betul.
Yeah. So
How
it's
you make them feel
yeah,
comfortable.
exactly. So the patient experience has to be there. So as hospital management, we always want to make sure that our patients have the best experience. And our patients need to understand that we want the best for our patients, and it is never our ill intention for anything, right? So I believe communication is always key, whether it's from the staff, nurses, doctors, management, right? So it's always a collective communication, teamwork, whether it's from the hospital side, whether it's from the clinical side. Having this kind of close communication is always the key for giving our patients the best patient experience. And that is the key that gets our patients to come back. And, it's 50% of the healing process.
Betul. It's
Yeah.
part of the healing
50% of the
process.
healing process is just having someone to smile at you, direct you, guide you, asking how are you today. That's, it goes a long way. So that happens on a daily basis, and that's something that I really look forward to. So like Dr. Lee, because I don't practice anymore, so Dr. Lee says that he will treat patients and see them recover, right? So for me, now that I've gone into management wise, seeing our patients leave the hospital happy.
Happily.
Yeah, with the
Kan.
treatment,
Aku
with
dah
the
sihat.
hospital.
Macam
Yes,
tu.
yes.
Thank you
And
to Dr. Lee.
correct. Happy with the nursing, happy with the doctors, happy with their hospital stay and treatment in our hospital. That really gives me that kind of satisfaction as well.
No,
Betul.
I would want to concur because I think the patient journey is something that is really important. So whilst I treat, but the rest of the experience within the hospital setting, as Dr. Liyana has mentioned, is also something that's really important.
Part of the healing process.
That is correct. That is correct because that's part of the whole package, the whole patient experience, and how they felt when they first came in, and how they felt throughout the stay until they're discharged.
Betul. And that what Damansara Specialist Hospital too is offering.
Yes,
Ah,
definitely.
that's
From the moment you
From the
step
moment you
into
come
the
in,
hospital,
you step in,
correct.
you will live happily.
Yes, you masuk, there's this curated smell that only Damansara 2 has.
Only
You-
Damansara Specialist Hospital tu je yang macam
Damansara.
ni. Macam tu lah
Yes,
contohnya.
macam tu lah.
We
macam
wish
tu.
we have other hospitals juga, but
Yes,
this is your
of
specialty.
course. Yeah.
So but I'm agree with you, Dr. Liana, because when you cakap tadi kata apa okay, patients ada yang complains and everything. Complaints so it happens every day, but it depends on how your team manage the whole situation lah, whether nak counter the complaints ke ataupun you nak handle the complaints ke dan sebagainya. I'm sure you have your comms team juga kan dekat hospital kan.
Yeah, we do. We have customer care, we have our PR and things like that.
PR and things like that kan.
So of course we have a team that manages all these as well. But sometimes, it's a collective thing. So sometimes like, even our doctors will step in if there's patient complaints. Even our nursing team. So it is just not one person that's at the hospital to manage that
Betul.
one thing. But generally we do get our whole team to actually try to improve in that sense and give them
you
that
as the
kind.
CEO, you oversee
Yes.
semua.
Overseas
kan?
sometimes jumpa jugalah.
Jumpa jugalah,
Jumpa.
yelah. Betul. Turun padang, kan,
Turun, always
groundworks dan
turun.
sebagainya. So, okay, being a CEO and so being the, sekejap nak selak balik, apa tadi? Consultant Interventional Cardiologist. Aku kena sebut betul-betul, takut
Such
salah
a tongue
sebut
twister
nanti.
lah.
Yeah.
Takut tongue twister.
Yeah.
Okay, being good at your job.
Yep.
Kan nowadays kita dapat tengok banyak dekat apa kita punya main streaming platform, stories pasal doctors lah, TV series pasal doctors lah. I dah lama nak tanya sebenarnya. Now that I have the chance to see both of wonderful people in front of me, I nak tanya, betul ke yang dekat dalam TV tu?
Macam like Grey's Anatomy.
Macam kan. Kita boleh sebut ke nama TV? Nama program tak boleh takutlah.
Tak boleh
Tak boleh, okay, tak.
Tapi Adan, I want to ask you a question in return.
Okay.
Now,
Hello, takut lagi nak tanya soalan.
which component are you referring to in the dramas?
Possibly I nak tanya on the lah professionally
The reality or some of the love stories that you're asking?
The love stories tu tak payahlah. The love stories tu nanti kita tanya dah
Yeah,
hujung-hujung. Now kita nak tanya yang pasal the reality of the life of a doctor tu betul ke macam yang they portray dekat kita punya TV.
Partial lah kot, right?
Well,
Doctor?
partial.
Partial,
I
I
think
think
partial. I think a drama or movie being a movie or drama, I think a lot of things are probably simplified for
Or exaggerated.
viewers.
Nak
Or
exaggerate
maybe
for
exaggerated.
viewers.
Exaggerated for
Yeah.
viewers, I guess.
Romanticize a bit.
That's correct. So,
Dramatize.
Yes,
yeah, but in truth, I think sometimes decision making can be more complex than what you see.
Correct.
The stuff that you deal with are probably a lot more a lot more sophisticated and not as simplified as what the dramas would show. But all in all, yeah, partially true, because I think most of the script writers would derive some of these from real life scenarios too, but they act it out. Yeah, partially true, I guess.
So dia actually less glamorous lah daripada apa yang kita tengok dekat TV.
Less glamorous and sometimes even more glamorous actually,
probably
depending.
both.
Yeah,
It
can- reality is
must
more
say,
glamorous?
Yeah, I must say they're
course.
quite similar actually. They're quite similar. Tengok lah, you tengok
Oh, I
cerita
kena
apa.
cari producer TV lah.
Yeah,
Buat
because
apa tu, Damansara Specialist Hospital tu punya behind the scenes.
Yeah,
Sebab dia more
yeah.
glamorous
Kena
kan.
follow
More
nanti
glamorous.
dekat
because
hospital.
kalau you tanya macam diagnosis lah contoh
Okay,
and most
diagnosis. We take one
diagnoses
example
are
lah.
diagnosis and most of these are actually real. Sebab tu ada juga many of my patients told me that they learn medical conditions through benda-benda macam ni, and then they will
That's
verify
right.
with me. Dia tanya,
Yes.
"Dok, betul ke macam ni?" I tengok, well, that's accurate sebab benda ni ialah as much as this is a fictitious thing and it's fiction, but tak boleh lah lari jauh sangat daripada yang sebenarnya. So relatively real, especially diagnosis apa semua, tindakan perawatan, management, the type of surgery
it's
that they do.
accurate lah.
Especially in medical terms, the medical jargon that diguna tu.
Betul.
Itu tepat. That's correct.
Oh,
Yeah,
okay.
that's correct.
Alright. Now, talking about that, let's say sebab tadi Dr. Lee ada mention,
Yep.
you are very macam, yelah, you are inspired with your patients as well. So, you have a goal every single day. So, let's say, kalau katakan macam, we are talking about Damansara Specialist Hospital
Yep.
tu lah. If I am like a new patient,
Yep.
let's say lah ada masalah jantung. Okay. I know that I nak pergi Damansara Specialist Hospital tu. So, the moment I masuk je Damansara Specialist Hospital tu, what is the, as both of you would talk about your branding kan, the moment I masuk je, what would be the first thing yang I akan macam terus grab in my mind yang macam, okay, this is the only hospital that could serve me well. Ada tak any element ke yang macam could make me feel like macam, okay, I feel safe here. Maybe because of your I tak tahu ambience ke ataupun you punya service, customer service
Yep.
ke. What would it be the factor?
Liyana, you want to take it first from the beginning of the patient journey?
Yeah, of course. So from the moment you step into Damansara 2, you will think, are you in a hotel or are you in a hospital?
Oh, I like that.
Yes.
Healing meets hospitality.
Yes, definitely.
Nampak, I dah
We
boleh jadi
are
host,
riding on
ambassador.
the hospitality, right? So we always say when you come to Damansara 2, we have a term that we use, hospital. So it's hospital and hotel. So you will be welcomed by a smell, a curated smell, very warm lightings, a very sophisticated design. We have an aquarium where
You have an aquarium
a
dekat lobby
huge
ke?
aquarium, right? So you can sit there and just relax and calm yourself.
actually that helps,
looking-
kan, Doc?
It does.
It does help.
I tell you, I have actually done it myself, and it really does help. And on
Yes.
certain days, you will also be welcomed by a pianist in the lobby.
A pianist?
Yes.
You have a pianist?
I do.
In the
We
lobby?
do. Definitely, yes.
Ada
yes.
penyanyi tak?
Penyanyi tunggu adan.
Okay. I nak tanya yang tu sebenarnya.
Oh, okay. Or Dr. Lee lah. Dr. Lee. I think
That's
Dr. Lee
interesting,
can do
okay.
part-time.
You have a pianist in the lobby?
Yes.
Wow.
We do. Yeah. So
Okay, ni first time tau.
We have a grand piano and a pianist in the lobby.
Correct,
Yeah.
correct. So
I
that's
boleh
the
nyanyi lagu
ambience.
Beauty and the Beast.
Oh, really?
Dia ada grand
Boleh
piano
duet. I
kan?
think you guys can duet, right? One. So that is the ambience that we are showcasing as Damansara 2. But of course, we want to highlight on our patient experience and patient journey as well. So our team is there ready to guide and assist. So you are not just a number. We are not just registering you as a patient, but we are giving you the best personalized care that we can possibly give you in Damansara 2.
Dr. Lee, what would you take up for?
Well, so from the clinical perspective, it is a collaborative effort.
Yes.
So, Damansara Specialist Hospital 2 is a cardiac center of excellence. So we treat practically every form of cardiac diseases. As you know, the heart is a complex structure. So we've got every form of facility and also the manpower to be able to address practically every form of heart-related issues. And we are also equipped with state-of-the-art machines, tools especially, in the procedural aspect of the catheterization laboratory that I was telling you earlier, and that's where the procedures are being performed. We have the latest Ultron 2.0 software. That's my personal specialty.
Ultra 2.0.
Ultron 2.0 is actually a machine
Okay.
that would actually assist me in performing what is known as precision angioplasty. So
Oh,
it allows
faham.
it allows me to then measure and look into the artery before I perform the angioplasty, the unclogging procedure, as well as after implantation of a stent, for example, to ensure that the procedure is done as precisely as possible. So all of these tools that we have at our disposal as part of our armamentarium would then ensure and allow that we are then able to achieve good long-term patient outcomes. So many a times, I think procedural success is measured short-term and long-term. But what we are chasing for and what our end goals are oftentimes is what is a good long-term patient outcome. And that's something that we are, or, that's my personal goal for every patient actually.
Because for your concern is at the end of the day is the patient.
Yeah.
Kan? The
Yeah.
healing process,
Correct.
ensure that they are happy with
That
the
is correct.
service. I tengah still amazed dengan yang pasal grand piano dekat.
You should come to our wards, right? So even our wards, we have a special smart ward. So all you have to do is like Google, search on the lights, and all the lights switch on.
In every wards ke?
No, so we have specific wards for that.
Okay.
But even our normal wards, it's very spacious, very family friendly. So we want to ride on giving the best comfort for our patients. But the smart ward, there are certain wards that have it, but we
Okay,
also have the normal
Yang
general
out,
wards.
how
as
many
well.
how many wards in total dekat Damansara
So we
Specialist
have
Hospital?
about 4 or 5 wards,
Okay.
but the only ward that has that is one. It's
Oh.
our executive suite.
Executive suite
Yeah, so
lah.
you will have specialized meals, you will have Google on the wall, then you are welcomed on the TV, get well soon and things like that. So yeah,
Oh,
hospital.
itulah yang
Yes.
kita cakap apa tu?
Giving the best patient experience
Giving the best
possible.
patient experience tu kan, it helps with the process of
Yes, it
recovery.
helps with the recovery
And also I
process,
rasa
the
not just for the
healing.
patients, for the family as well.
Of
I
course,
pun nak
it's
tidur
also for the
hospital macam tu.
family.
Google turn on the light. Lah.
Careful what you wish for.
Patient tidur, Google turn on the light. Macam tu.
Betul, tak payah bangun jalan.
Tak payah
right?
bangun.
Yeah, no.
Kalau
It's
macam tu,
very convenient.
like my family member ke ataupun my friend ke, kalau sakit ke apa ke, I'm willing to jaga as long as dia masuk sini.
Yes.
Damansara Hospital tu, okay, I pergi. Executive suite.
Please come.
Sakit tengah-tengah malam ke tak apa, Google turn on the light. Macam tu. Anyway, enough about that. Semuanya, it seems like both of you are you love your job very, very much. You enjoy doing what you are doing and you are very good in doing what you are doing. So, what makes you macam, at the end of the day, tadi I dah tanya soalan, the first day what motivates you in the morning. So, what is the last thing that you would do every single day at night before you end of your day after your tiring day? Maybe it's a rough day for both of you. So, what will be the last thing that you would do every single night? Because I have a friend who are doctors. And constantly also I know that they, yelah, doctor, I tak sure lah doctor tu diorang doktor apa kan, pangkat apa ke, maybe just a regular doctor. But most of the time, what would they say adalah being a doctor is a stressful job. Kan, sangat-sangat stressful. Nak pula kerja hospital dekat KL, rumah dekat BTHO contoh, kan, traffic jam lah, apalah, shift 8 jam, 9 jam, 10 jam kan. So, for both of you, contohnya, what would be the last thing that you would do every single day just to tune up balik you punya mind? Because tomorrow will be a hectic day lagi ni. Okay.
The last thing that I do every day is to reflect. Is to reflect on how my day went. So I think, self-reflection is something that is really important because what do I reflect on? I reflect on how and what I've done throughout the whole day and how I can possibly make tomorrow a better day than today.
Not just to you, but to the patient.
To everybody,
as well, to
collectively.
everybody.
How can I treat better? How can I perform something at a higher level as compared to what I did today? Because it is through reflection that you then know where your weaknesses are and what you can actually possibly improve, so as to have a better day tomorrow. And I think this sort of a reflection is something that I've been doing for a long time. The point that you made about being stressful, well, that's interesting. Now, I think stress really is a subjective thing. A stress may be stressful to somebody, but it is more important that the way you handle the stress that defines what stress is all about.
Faham. The way you handle the stress.
That is
I nak
correct.
elaborate lagi Pak
It's
Nizat
stress
lagi.
management. It's stress management. So many a times, as much as on the exterior,
Okay.
daripada luar tengok, oh, benda macam stress kan sebab ada banyak benda, ada banyak kerja, balik pun lambat. But the keyword here is enjoy. If you
Do
enjoy,
you love your job?
do you love your job? If you have the passion, if you're passionate enough, I can tell you anything that appears to be stressful on the outside, but internally you are just calm. It doesn't, you thrive under pressure. You rise above all of those things, and that's in essence what I do really. Yeah. So work doesn't get to me. The duration does not get to me, partly because I think I'm used to it over the years, and as an interventional cardiologist, patients can come in at any time of the day. So we have got to be prepared. There's no such thing as to select working 8 to 5, because if it means that there's an emergency coming at 3 in the morning that requires
Then
an
that's the
emergency
emergency.
procedure, then we head back to the hospital with that sort
Even
of.
though you kat rumah masa tu.
That is correct. That is correct. But we head back knowing full well that we would be heading back to save a life, and that's what drives me.
I mean, I totally agree with Dr. Lee, right? I mean, I think as doctors, right, we've been through everything, I guess.
Yeah.
So to handle stress, I mean, not to say it's easy. I mean, of course, stress is not easy, right? It's never easy, but because you've been through so much, right? So you always need to understand that for every problem, there's always a solution.
Yeah.
If you have that in mind, right, you will always believe and understand that you can manage anything.
Especially doctors.
Especially doctors, actually, especially anybody. I mean, everywhere is stressful, not just doctors, not just hospital, healthcare, and things like that, right? No matter what you do, you'll always end up having a stressful day or a bad day, right? But you always need to reflect and say, like, you know what? There's a way around everything, and everything is written, right? So you're there for a reason, and there is nothing that will he does not burden you more than you can handle. Yes,
Correct.
yes.
Betul.
Allah
So
does not burden you for whatever more than what you can handle. So with that in mind, right? You can definitely understand that you can do this. You can definitely do this. So that's something that I see on a daily basis. Because of course it is stressful, but at the end of the day, you know that you can overcome it.
Betul.
Whether it's with your family, whether it's with your friends. I mean, people unwind in different ways. So for me, sometimes I have conversations, I have coffee breaks. Just sitting and having a sip of coffee. Like I think Doctor said
Lee
he
tak boleh buat sebab dia tak
Doctor
minum
Lee tak
coffee.
boleh minum coffee, right? He's already naturally caffeinated, right? So I need a lot of external caffeine. So maybe that's how I unwind, right? But that actually makes me, it drives me better probably. So if you do sports, that's
Then
how
you play
some people.
sports.
Yeah, then that's what you do, right?
Betul.
So it's just finding time for yourself and looking back at your day. Don't concentrate on the bad things. Never concentrate on the bad things.
That would be a very
Yeah.
a good advice lah to all of us.
Yeah.
I think mungkin sebab both of you are doctors. So you have to also tune in. I believe macam ni lah, because kalau kita nak heal orang, kalau kita nak merawat orang, we ourselves kena centered ourselves dulu kan. Betul tak? Internally, like internally you must be at peace first. Then also you are able to heal other people. You are able to make sure that okay, yelah nak mententeramkan patients in front of you ni. I sakit jantung datang jumpa Dr. Lee, sakit jantung kan. So you need to make sure that I am, as a doctor, I need to make sure that myself is centered first, then also then baru I boleh calm you down. I need to make sure that you are okay too.
No, that's really true, Adan, because sometimes as being a captain of the ship, you cannot be appearing to be flustered
Betul.
or unstable in that sense, because a lot of people are actually waiting for directives from you. So you have to be calm, you have to be stable, you have to be in the position to give out instructions, etc. You have to be a good commander of the team.
I hope that this episode kan boleh for the viewers lah, kalau dia orang when they watch this episode, they can understand that being a doctor is not as easy as that, you know. Because from this conversation, now that I realize that you are the safeguard. Kalau you sendiri as a doctor, you pun tak centered yourself, then you are not able to heal other people. You are not able to make sure yang macam you nak calm your patients. You nak make sure that your patients are in a good conditions. You nak make sure that you are okay. I'm telling you that you are okay. But if I am not okay, how am I able to tell you that you will be fine?
Very true.
You will be
That's
okay.
true.
Other
That's
than you have a grand pianist at the grand piano at the entrance, kan? You yourself have to play a very very big and a major role for that, kan? True.
Yep.
So I really hope that kalau macam orang cakap, I think especially kalau ada yang macam young graduates, medical who are currently in a medical school. So when they look ataupun they watch this episode, they can understand that if I want to be a doctor, it's a major role, it's a big responsibility, and it's not just aku pergi hospital, aku rawat orang, lepas tu aku balik. It's not just that. It's beyond that. The wellness part lah, you know, the healing part lah. Lepas tu you are a motivator as well. You have to be the motivator. If you are as a doctor yang, you know, specialize in your own part. Tapi kalau macam you know, you lead a whole management team, you have to look in a bigger aspect pula. You're not just for the patients, but for your staff. You know, for the most of the things dekat hospitals kan, dia punya, you know, the ambience ke apa ke, the management things lah, kan. So it's a major role, it's a major thing. So talking about that kan, I nak tanya for next year, because we are currently at the end, almost the end of 2025. For next year, what is the big new things for Damansara Specialist Hospital 2?
So we are, like Dr. Lee said, right, we're the Center for Heart and Lung. So we have a lot of cardiac surgeries. We have minimally invasive cardiac surgeries. So there's no longer like big scars. It's just very minor, small scars, intervention cardiology, robotics. So we are really pushing on our robotics. So
robotic, meaning to
yes.
say that for next year there will be the more on...
We've actually already started, but
Okay.
we are pushing it even further. So, you know, if you need a total knee replacement, hip replacement, you know, urology, gynecology, all this can actually be done in a robotics.
Faham.
Through our robotics.
I will go into that on the robotic part, sebab I nak tahu
Yeah.
juga what is the big thing for 2026, and then you mentioned robotic.
Correct,
We will go
correct.
deeper into that. But before that, kita take a few seconds for break. We'll be right back. All right, welcome back to Health Beyond Borders with me, Dr. Liyana, and also Dr. Lee. Say hello back to the camera.
Hello.
Hi.
Okay, tadi kita borak-borak sebenarnya. We just talk about how Dr. Lee sebenarnya tak tidur because he's naturally
Naturally
caffeinated.
caffeinated.
Naturally caffeinated. He doesn't choose coffee. Is there any personal reason why you don't drink coffee?
Not really. I mean, are you a coffee drinker?
I'm not a coffee drinker,
Okay.
but I do drink coffee
Why do you need that?
because I feel like, okay, semua orang minum coffee, I nak minum coffee lah.
Okay, so to be
I just like to join the
Right, to
trend.
be
Okay, I
trendy, to
need
be
coffee.
trendy.
I need
Yeah.
coffee.
I need coffee.
Macam hari ni I rasa macam okay, I rasa macam I nak minum coffee. Okay lah, let's buy coffee.
Right,
Macam tu.
right, right.
I
It's
need
not just the matter of
coffee.
like I have to drink coffee.
Like, please don't talk to me without my coffee.
So you don't have any personal reasons lah.
Tak ada. I mean, I guess if you're thinking about caffeine, then I probably don't need them to start my day.
Bagusnya,
But
Dr.
as a
Lee.
beverage, it's just not something that I really need or crave.
What's your casual beverage?
Casual beverage?
Kosong.
Any tea?
So
Air kosong? Yeah, that's
green
healthy.
tea,
Yeah.
right?
Yeah, green tea.
Malam-malam dia tidur, dia
calm.
reflect diri dia
Matcha.
dulu. Okay, what did I do today? Coffee tak
Matcha.
minum. Minum teh.
Healthy because he's a cardiologist.
He's a cardiologist.
Yeah,
Then again,
of
they come back to
course.
dia punya apa tu? Apa job scope dia.
Job scope.
You're a cardiologist. You jaga you punya.
Yeah, masa
kesihatan
tidur pun
jantung.
fikir kerja. So you embody the role of cardiology when you sleep, you see.
Ush. Oh,
Oh, itu dah dalam.
Ada. Dia memang.
I pun motivated lah speaking to my
Itulah.
doctor ni. Aduh.
I kalau I tidur malah I tidur lah. I tak ada nak fikir
Fix,
pasal apa
fix.
I buat.
Done.
Tak ada. Done. Damage is done.
It's all done.
It's all done.
See you
Esok aku
tomorrow.
fikir.
See you tomorrow.
To see you tomorrow. My version, tomorrow's version of me can think about this. For today, I'm done. I've had enough.
Aduh, yeah.
Okay, I nak tanya yang pasal tadi, robotic tu.
Robotics,
That will be another big thing for Damansara Specialist
Yeah,
Hospital
yeah, yes.
next year.
We've already started.
Okay.
We already have our doctors who do robotics. So we have quite a good number of doctors who do it. So especially if you're looking for like knee replacements and things like that. So you can do it. So the healing process is less. It's done with so much precision. The incision is also less. So recovery process is so much faster. So yes, robotics is the way to go. So you said something about what we are looking forward for 2026, right? So of course, digitalization is one of the key things that we want.
And you have smart watch dah kan
Yes, we
sekarang
already
kan?
have smart watch, so we're embarking in a lot of digitalization. So another thing that you have to do is like our KPJ Care apps. So we have a KPJ Care app that you have to download today, Agan.
Oh, ya ke? Kalau I download
You
KPJK app, saya dapat
download-
voucher apa-apa tak?
Yes, you dapat voucher. You get promotions and things like that.
Oh, I like promotion.
Yes,
Nampak
so-
tak Malaysian people, we like vouchers, we like free stuff.
Kita ada
Okay.
like buy one free one kind of
Okay,
thing,
tell,
right?
Tell more.
But of course, in your KPJ Care apps, your appointment scheduling is so easy.
So much easier lah.
And then, so for instance, you come to Damansara 2 for an admission or an outpatient. So all your records are in your app.
So for example, kalau macam I have an appointment.
Yes.
So ada tak macam dia bagi dekat apps tu macam preparations before you go for the
Yeah,
appointment?
so sometimes
it
they
will be in there lah.
do give that kind of information, and then once you go home, you can see your lab results, you can see your radiology reports, you can even see your medication history. So I know a lot of people they never remember, right, Dr. Lee? Like
Yeah.
it's so
betul.
difficult for
I pun.
people to remember their medication. So all you have to do is open your app, and your whole history of medications are there.
Faham.
Yeah. So the KPG, and there's also a chatbot. So her name's Ira.
Ira. My
Ira.
cat name is Ira.
Good. Then you should try. You just
Okay.
download it. You tanya Ira, where should I go for
Okay.
robotic surgery? Is
So
it
dia akan
Damansara
respond.
too?
It's
Yes,
24
yes.
hours
So seamless.
response.
It's immediate.
It's immediate.
It's immediate.
I think yang ni sangat bagus tau sebab macam we have elderly kan,
Yeah.
yang mana yang they need to check, they need to see their medications punya history,
Yes,
the
yes.
report, medication report semua kan, so they
and
can just go to the
it's
app and see
correct.
everything is in there.
And it's not just for Damansara too, right? So KPJ as a group, we are 30 hospitals.
30 hospitals
Yes,
in
we are
total.
30 hospitals in total.
Semenanjung Malaysia dan
Yes.
Sabah Sarawak.
Yes, Sabah Sarawak and Semenanjung. So in Central itself, we have 11 actually in Klang Valley. But your KPJ Care apps, no matter where you go, you will have that record and you can see it. So if you've been to maybe Damansara 2, you've been to maybe Ampang, you've been to maybe Sabah and things like that, everything will be in that KPJ Care app.
So KPJ Care apps tu dah established for how many months or years?
So it's been there for years, but we've already fine-tuned it.
Upgrade lah.
Yes, so upgrade a lot of new features. So this year, next year is gonna go have more features, and it's
Such
gonna
as?
make. So we have radiology reports, right?
Okay.
So sooner or later, we will get your discharge summary and the actual
Oh.
pictures of your radiology reports. So sekarang kita ada reports, right? But our new PAC system in Damansara too, you can actually get your reports immediately through email. So there's no longer the CD
Tak payah dah nak
and the
tunggu.
film yang besar-besar bulky tu, right? So
This week
yeah,
datang
towards
jumpa doktor, lepas
digitalization.
tu next week datang lagi 2 minggu.
Yeah.
By the time nak tunggu 2 minggu tu kita dah lupa dah.
Of course, yeah.
Tak ingat dah nak kena jumpa doktor. So
Tak
now it's
ingat.
everything in
Yes,
there,
everything's in one app. In your phone.
in your phone. Bila-bila masa je you boleh check.
Boleh.
Okay, so the robotic as
Yes.
well as you have smartwatch and now
Correct.
KPJ Care apps.
Yes.
So very interesting. Like that will be another big thing,
Yeah.
another big milestones for KPJ next year especially.
Yeah,
Kan? So
yeah.
as for example, okay, this is an open question
Yep.
lah. Kalau katakan I nak a 20-year-old student sekarang dekat medical school, what is your advice if to these people, to the students, because they are very much interested in joining ataupun in embarking their venture, their life into healthcare punya industry, might be becoming a doctor ke? So what would be your best advice to them? I'm sure diorang tengah tengok sekarang. Kalau tak tengok aku paksa tengok. Okay, what would be your advice?
Well, it is a rewarding profession.
A rewarding
It
profession.
is a very rewarding profession for a variety of different reasons. I think, for one, I think Dr. Liyana, you would agree, and we have spoken
Yes.
about how, in spite of going to med school, but our paths can ultimately be different. So, your job scope is aplenty. There are just so many different options for you after graduating from medical school. So even from the very beginning of time, you can choose a career in healthcare,
Yeah,
like yourself,
of course.
in administration. You can also choose to then be a doctor that practices, and amongst them, the broad categorization or the differentiation is whether you become a physician or a surgeon,
Faham.
whether you're in a surgical field or whether you're in the medical
Depends,
line, so to speak. And under the umbrella of internal medicine, there's just so many different subspecialties that you can choose. Like for me, myself, I'm in heart, so cardiology. You can be in respiratory, lungs. You can be in endocrinology, etc. For the surgical field, you can be in ONG, obstetrics and gynecology. You can be in surgery, orthopedics. So your options are aplenty. By having all of these options, it would mean that there is always an option that would suit your needs and your personal interests. Because, like I said, I chose cardiology and interventional
Because that
cardiology
is your
because that's
personal
my
interest.
personal interest and passion.
And
but
you know it since you
that
were...
is correct. That is
Betul.
correct. It may not be everybody's cup of tea, but there's always something for everyone. But irrespective of whichever that you ultimately end up choosing, you are directly involved in patient care. So no man is an island. I would depend on my colleagues too. And more often than not, this is a multidisciplinary sort of management for patients, in that, well, as simplistic as it sounds, patients do not only have one particular medical condition. Sometimes they've got 3 or 4. That's mean sakit dia cuma jantung. Patient yang sakit jantung mungkin sakit gastrik, mungkin sakit benda-benda lain, of which if it falls out of your scope, then it is always best to collaborate. A multidisciplinary approach with your colleagues of different speciality.
Hence why it is a rewarding experience.
That is correct.
a
It's rewarding
job.
because irrespective of whichever field you're in, you are helping the patient in one way or the other. Yeah, you are helping either as the main doctor treating the patient or as the secondary doctor, as we call it. And you lend help to your colleagues,
Betul.
needing your expertise in interpretation of whatever images, etc. You're always involved. So you're always helping a patient, you're always helping the needy. You're always trying your level best to heal people, which is why, irrespective of whatever stress, like you said, they're probably watching right now, if you're in med school, the journey itself can be tough. Yeah, the journey itself can be tough. But ultimately, do persist. Because if you succeed in your end goal to get what you want, it is, trust me, an extremely rewarding profession.
I totally agree, Dr. Lee. I mean, go for it.
Yep.
That's what I would say, right? Honestly, I do miss it. It is very rewarding seeing patients on a daily basis, and no one patient is the same, right?
Yep.
It's different in terms of family, character, disease, perangai, semua lain, right? But it's very rewarding, and it's very interesting, and you learn something from different patients all the time, every day. So, and they teach you as well, right? So our patients really humble us on a daily basis, right?
Oh,
I
kejap. Hold on. Our patients really
humble
humbles
us.
us.
Yeah.
Yeah, they do.
That's why orang cakap pekerjaan as a doctor ni adalah pekerjaan yang mulia.
Yeah, they do. They
Wah,
do.
dapat belakang sah.
Wow, betul betul. So yeah, of course. I mean, do I miss it? Yes, but of course I do love my job
Yeah,
right
yeah.
now.
Sebab you dah
Um,
management, you dah on the
yeah,
management
but
field kan.
being from a medical background, it really helps me on my
Faham.
daily basis, on a day-to-day basis, right? In terms of how I operate the hospital, understanding doctors, speaking to doctors, right? It gives me a very good sense of collaboration, because hospital ni besar. You have
Betul.
so many people, right, to manage. It could be your middle management, it could be your staff, it could be your nursing team, it could be our doctors, it could even be our outsourced, like our cleaners or our security guards. So it is a very big organization, and it is definitely a team effort,
It's a
right?
team effort lah.
Yes, it's a team effort,
Especially
and
you as a CEO kan. You have a lot of teams
correct.
down below
It's
you yang you
always
kena
teamwork,
manage.
right? There's
Yeah.
not one person that can do everything. And you need everyone's collaboration to
Betul.
make the whole thing successful. And the communication is definitely one of the most important things that is needed in hospital.
Correct.
And this collaboration is the main thing that gives our patient that true patient experience that we really strive for on a day-to-day basis as hospital administrators.
Yeah, as hospital administrators, because you
yeah.
nak manage a lot of things.
Correct.
Mana nak maintain piano kat bawah tu lagi. Tu satu hal
Please
juga.
come. Please come. I will
I
show you
will.
the piano.
I will. I datang nanti I call you.
You call I, you text I, anything.
Okay, basically for next year, you all know about MYMT. Malaysia Year of Medical Tourism
Yep.
2026 kan. So
Yep.
we all know about MYMT, which next year will be tahun melawat Malaysia, visit Malaysia, as well as kita ada tahun melawat Malaysia Year of Medical Tourism 2026, and we have been promoting a lot about MYMT 2026. So for Damansara Specialist Hospital tu, what will be your tell us pasal you punya excitement for next year, because I'm sure next year we will be bombarded with a lot of informations and activities, fun things going on pasal MYMT 2026 kan. So do you feel excited, and what is in stock for Damansara Specialist Hospital tu for your plan lah for MYMT next year?
Of course, we're all excited, right? And Damansara too, we're getting more and more health tourism patients. So we're venturing into like Indonesian, Cambodian. I think recently we met with the Oman police. So, it's so amazing to meet people from all over the
Different
country.
backgrounds
Yeah,
kan?
so I mean, if you come to the hospital, you will see all these people from different countries. I think recently we've had a patient from Australia. She's super excited. She's telling all her friends to come to Damansara to, meet our doctors, do their surgeries. So yeah, I mean, we are really trying to redefine healthcare. Redefine healthcare whereby we want to combine not only medical excellence,
Yep.
but also we want to give that comfort and patient experience. We want to give a very heartfelt human touch.
Human touch.
Yes.
Betul.
Hospitality. So we write on very good hospitality, right? So like you said, Malaysia is going towards tourism and things like that, because Malaysia has that hospitality. We are known for our hospitality. So Damansara too, we are also heartfelt hospitality where we strive on patient experience.
Especially kita sebagai seorang rakyat Malaysia kan, we are
Yeah.
Malaysian. So
Correct.
kita ada that Malaysian touch, I believe kan. Pergilah
Yes.
mana pun,
Yeah.
people will always remember on our Malaysian touch, because we
We're
are
so
not just heal
friendly.
the people.
So
Kan, kalau macam kita ada tourist patients daripada luar kan, kita bukannya merawat sahaja, but we give them the experience. Sila dapatkan experience tu di Damansara Specialist Hospital tu. Nampak. Tapi betul tau, because for me, I always believe that kita sebagai rakyat Malaysia kan, we are so lucky because we've been brought up in this culture, and we learn about that hospitality. We learned about our touch. We learned about our
Multicultural.
multicultural. Kita belajar because it's been installed with us within our nature daripada kita kecil lagi. So kalau you tengok macam doctors, and I believe all of our doctors kita kan, they know how to make sure ataupun how to actually heal the patients to not just medically but as well as internally and mentally heal them kan. So macam Dr. Lee as a cardiologist
Yep.
kan, so I'm expecting that next year might be kita akan receive a lot more
Yep.
patients, tourists daripada luar kan. So
Yep.
what do you take up for that? How do you take up for that?
Exciting times. In fact, as what Dr. Liyana has shared, we have been seeing a lot of patients from abroad too, and I've personally treated a lot of patients from abroad as well. And their overall feedback has been nothing but positive. I guess quality of healthcare in Malaysia here is high, and
And
the
excellent too.
and excellent. I mean, in every facet that you can think about. So we are definitely a healthcare destination. And in fact, this is not something that is only for next year, as what you mentioned, but this has been in existence for a
Betul.
substantial period of time
Betul.
as well. And patients have actually chosen Malaysia as a healthcare destination for a long time now. Yeah, so I think it is about continuing that trend of being service providers, because in every specialty that I can possibly think of, we are most definitely ready. We are well equipped with, I use this word again, manpower,
Yep.
as well as the facilities, technologies, etc. We are definitely ready to serve.
Which is very very good lah. So, but betul lah Dr. Lee cakap
Yeah.
tadi, it has been here. Kita
Yeah.
dah buat dah. You know, cumanya tahun depan tu will be the year of announcing it,
Yeah.
making it official.
Yeah.
Because kadang-kadang mungkin ada di kalangan kita yang tidak menyedarinya or they do not know about, you know, the medical tourism. Because medical tourism is an industry that is very very important for our economy as well.
Yep.
So ni mana-mana yang tengah dekat medical school ni please macam tu. Because medical tourism is a part of macam orang kata apa, it's a pillar for our economy strength, our national
Definitely.
economy strength. So I have like one last question for both of you.
Yep.
In a phrase, can you describe ataupun persuade whoever who's watching our episode hari ni kan, like why do you have to choose Damansara Specialist Hospital tu? Why?
So Damansara 2 is redefining healthcare. So we are combining both our medical excellence as well as patient experience. So that's why you have to choose Damansara 2. So yeah, I mean, it's not just the ambience. It's not just the, it's a combination of the ambience, the environment, the
Betul.
medical excellence, the quality of care that you receive from our clinical teams. And it's also the whole patient journey. So that's the important thing. It always comes back to patient journey and patient experience. And that's what we strive for on a daily basis.
And I believe it's not just about that.
Yeah.
You punya doctors,
Yes,
you know,
medical excellence
your
and
medical
patient outcome.
Yes, betul. You punya doctors pun are very very good, you know.
Very.
Masing-masing mempunyai their qualifications, the highest qualifications, you know, and I'm sure they are trained well as well. So I think for that it gives us quite orang kata apa dalam satu, because we have been talking about
Yep.
our experience, about your life as a doctor, so it gives us a lot of motivation for me personally, I think kan, because being a doctor, macam saya cakap tadi, as a doctor you are carrying such a huge, and it is a major responsibility sebenarnya kan. It's not just about for you bangun pagi, okay, pergi hospital and then you treat your patients and then you see your patients. No, it's not just about that. It's beyond that. Dan itu yang sebenarnya what we from Malaysia Healthcare and Travel Council menekankan. It's not just about apa orang kata medical punya experience, but it's actually a holistic experience. It's a patient's journey, the wellness and then the healing kan. So kita nak cuba connect the dots when healing tu meets the hospitality. It's not just about pergi hospital and then you receive the treatment and then you go home. No, it's the hospitality, it's the experience. Now that you have KPJ punya apps, kan, and then you have the smart wards, dan itu sebenarnya membantu para pesakit and especially our patients to feel special, feel they are treated well, and they are, orang kata, in another form of it, macam memudahkan ataupun membantu mereka to heal faster. And I'm sure you are doing it very, very good. I'm inspired. Saya sebenarnya inspired dengan Dr. Lee ni jugalah kan. Tak minum kopi semua.
So healthy lah, doctor.
So healthy lah,
Yeah
doctor,
Very
kan?
inspirational.
Well, if I may, I've got to, or I must return those words that you said with compliments, because I think both Dr. Liyana and I have enjoyed this session.
Yeah, of course.
I guess the subject matter here is rather lighthearted. We're here to share our day-to-day experience, and probably giving insights to things that are not often spoken about. And we are glad that we have been invited and we have had this opportunity to meet a host like your good self, who
thank
has
you.
who has been a wonderful host, and I think that we have really spoken our hearts out today, and we
of
look forward to have
course.
sessions like this again.
So nanti patients you kan, yang mana-mana yang dah pernah menerima rawatan daripada Dr. Lee, kalau nak belanja kopi, tak payahlah.
Kena belanja tea.
Kena belanja tea.
Kena belanja tea.
Dia minum caji. Dia minum tea macam tu. But Dr. Liana, any words, final words that you nak cakap?
Yeah, thank you so much for having us. I think it's an honor on behalf of Damansara to being here on MHTC. Speaking to you, you don't look 35 by the way.
Mungkin sebab I tak minum kopi sangat kot.
Maybe lah.
macam
So I
Dr.
need to
Lee.
stop drinking coffee lah.
Tapi I ada soalan nak tanya.
Okay.
Tiba-tiba teringat. Betul
Yeah.
korang cakap kalau minum kopi, dia actually mencepatkan penuaan?
Oh my god, I hope that's not true.
I ada baca somewhere, but I'm not sure kat mana I baca. But then that
I
was
don't think
what
it's like
I
a
read lah.
specific reason. Right?
Yeah,
I mean,
I don't
I
think so.
think there are multiple factors that, age you faster, right? I don't know, maybe stress, maybe lack of sleep, not drinking enough water.
Yeah,
I mean, maybe drinking too much coffee could do
Could
that,
lead
right?
to-
I mean,
yup.
right, Dr. Lee? I don't
That's
think
correct,
there's
yeah.
always
No,
one reason
no.
for
So
aging.
please carry on.
Right? I mean, okay lah. Maybe I'll reduce it a little bit, right? But yeah.
Mungkin yang cakap tu doktor yang stres tadi tu kot. Dia kan stres. Mungkin dia yang type dekat social media. Macam tu. Okay, anyway, that was a wonderful conversation.
Yep.
Hearing the such real stories daripada Dr. Lee as well as Dr. Liana talking about their experiences. I know that today's topic is a bit lightweight kan. Kita tak cakap banyak sangat on the medical terms and whatnot. I just want them to share, especially to those yang masih berada di medical school, so that you can I hope that you can gain something from these two wonderful doctors, the experiences, what makes them feel motivated every single day. Before tidur, reflect balik diri apa aku buat hari ni, macam tu. Maybe you can apply the same thing too. And also for me as well, thank you very much. I feel so humbled listening to both of your stories. Anyway, until next time, sebelum saya nak menutup episod hari ni, please subscribe our channel, Malaysia Healthcare, and also our social media, Malaysia Healthcare Instagram. Search je tanda tu, and so Malaysia Healthcare. You can go search on our Instagram. Also kita ada malaysiahealthcare.id, that is for our Indonesian team. And also stay tuned for our MYMT 2026 next year, because we will be blessed with a lot of informations and news and a lot of activities and events next year. So kita pun dah di penghujung 2025. Ada tak final words nak cakap before kita wrapped off 2025 this year? Sikit je lah, sebab tadi orang tu dah buat macam ni kat saya.
Oh, really? He has done that sign. Well, see you in 2026.
Oh, pendek betul. Dr. Liana, go ahead.
Download KPJ Care.
Oh, dia promote.
Yeah.
CEO.
Promote,
That's how a
of
CEO
course.
would talk. And also download KPJ Care app.
Please come to Damansara too. I mean, I think you need to see it to believe it. Maybe you can feel the experience, meet our doctors, meet our team.
And also boleh main piano kat bawah. Okay,
Piano.
until next time.
You have to come, yes.
I
will
have to.
show
Okay,
you.
nanti kalau I datang, I call.
Yes, of course. Text me anytime.
Thank you, Dr. Liana. Thank you,
Thank you
Dr.
so
Lee.
much.
Until
Thank
next
you very
time, I'm
much.
Adan signing off from Health Beyond Borders. Thank you very much. Oh, bye-bye. Hey,